My name is Jody Wells. I'm Director of Surgery at Fort Logan Hospital in Stanford. I've been with Ephraim McDowell Health for 21 years now, and I am in charge of the CODA program within Fort Logan Hospital as well. CODA program is a program that we have a contract with, where when an individual comes into our hospital and passes away, we are able to contact Kentucky Organ Affiliates Association and work with them on organ and tissue donation for our patients and their families. Registering is really easy. You can do that either online at the CODA website, or you can go to your motor vehicle place where you live and register there, and all it requires is a form of photo ID. No, it doesn't cost anything at all to donate. The patient's family is in charge of the care that the client receives at the hospital, as well as any funeral costs, but the actual donation is actually covered by the recipient's family through insurance like private insurance, Medicare, or Medicaid. There is no age limit to donate organs. The tiniest newborns are able to donate, up to the elderly individuals that we serve in our community as well. There are tons of organs and tissues that can be donated. The life-saving organs are obviously the heart and the lungs, the liver, eyes, corneas, saphenous veins, heart veins and valves, and then all the way down to skin is a donation factor as well. The condition of the patient at death is really what determines what is able to be donated. So if their wish is to donate organs, depending on what condition their body is in at the time of death, depends on what kind of organs can be donated. Some life-saving measures may be required to keep those organs alive and viable if they choose to donate all their organs, but things like corneas, saphenous veins, skin, things like that can be donated most of the time with organ and tissue donation, and those are the things that kind of are forgotten about. Most people, when they think organ donation, they think heart, lungs, and things like that, but skin is also a very important factor with organ donation. You can donate to specific people if that's the way you choose to go with organ donation, and that's called a designated donation. There has to be a match done within the system to ensure that your organ is actually going to be a match with that person, and if that is not the case, then they can do some kind of within the organ donation system, they can do some kind of matching with CODA so that that person can get maybe something that is matched to them and yours can go to someone else, but you can designate organs as long as they are a match. They are put on the waiting list and then they are matched. They go through a full screening process with the CODA organization, and they take care of all of that. One of the most important things is to inform your family members of your wish to donate tissue and organs at end of life. They need to be made fully aware of your wish to donate at end of life. And then you can sign up at the CODA organization website, or you can go to your motor vehicle institution within your community and sign up. And then at the time of death, we do call CODA for every death, and they contact the next of kin or the family to determine the patient's wishes and work well with the family to determine actually what can be donated at the time of death. And then those patients are they go through the registry to see what patients on the registry can actually be matched to the organ donor. They go through your local OPO. So like if I'm at Lincoln County, then someone in Lincoln County is on the registry, then they are going to get the first option to receive my tissue and organ. If there's nobody in my local community, then they go out from there, and they can even go nationally. CODA has some really good materials that they offer that can kind of break the ice when talking to family members, because it is kind of a sensitive topic. One of the most important things to remember is this is a gift. It's a gift that you can continue giving even through your death. And so many people can be touched by this gift of life. One organ and tissue donor can impact up to 10 patients with organ and tissue recipients. So when families can actually see that even through death, their loved one can keep giving, that is really kind of wins them over with feeling more comfortable and more confident in their family member's decision to donate. A lot of families are really worried that it's going to transform their look, that it's going to affect like an open casket, and that is definitely not the truth. Any kind of organ and tissue donation does not affect any kind of open casket or funeral at all. It does not transform the patient in any way. I think right now the numbers are so high because we have gotten so good at organ transplants that more people are being placed on the list because the transplants that we have been able to do have been becoming more and more successful. I think that organ and tissue donation is still something that family members are not real comfortable with sometimes, and I think that it's up to us as healthcare providers to get the word out how great of an opportunity it is to be able to help someone in the time of death. Every day there are more than 20 people in the United States that die without receiving an organ or tissue transplant, and there are over 100,000 people on the transplant list. The gift of life is something that we can continue even after our death. It's one way that families can continue to remember their loved ones. I've seen videos of heart transplant recipients meeting the donors' families and the joy that it actually brings, even after that loved one has died, to hear that heartbeat and to see the families that they have touched and to see the lives that they've transformed. It's just an excellent way to continue even after you have passed and be able to touch people even in your death.